All right, so I am assessing outside of the room, making sure there are no precaution posters saying that I need to adore PPE, any red flags. I don't see any, so we're going to go ahead and enter the room. Hello, my name's Aubrey. I'll be your nurse today. I'm going to go ahead and shut the door for some privacy. I'm going to perform hand hygiene. At this time, I'm also going to clean my stethoscope. Can you tell me your name and date of birth, please?
My name is Jordan. My birthday is 11/21/1997.
Perfect. I'd also verify that with the wristband here. Can you tell me why you're here today?
For a checkup.
Perfect. All right. And do you know where you are?
Dickerson Hospital
Okay. And do you know the month and the year?
is 07/24.
Perfect. So patient is alert and oriented. Just upon inspection, I'm noticing that facial features are symmetrical. I'm not seeing any discoloration. I'm not seeing any wounds. I do not see a PICC line. I do not see a central line. I also do not see a Foley, but we'll get into further questions. I'm going to be performing a head to toe assessment on you today. All right, so I'm going to ask you a bunch of questions and then we'll do some tests. I'll document and then we'll be on our way, okay? All right, I am noticing that your vitals have already been completed. They look good, so I'm not going to do those again. So now I'm going to go ahead and move on to some questions. How would you like to be addressed today?
As Jordan.
As Jordan? All right, thank you, Jordan. And do you have any history of coming into the hospital, like any hospitalizations or prior surgeries?
No.
No. Do you have any headaches?
No.
Chest pain?
No.
Shortness of breath?
No.
Coughing?
No.
I notice here you're not using any O2. Do you use oxygen at home at all?
No.
Nope. Do you use any assistive devices such as like walkers, canes, glasses?
No.
No? Perfect. Okay. Any nausea or vomiting?
No.
Any constipation or diarrhea?
No.
Any abdominal pain?
No.
No. Any tingling or numbness in any of your extremities?
No.
No, perfect. And any urine frequency increases or urgency increases?
No.
Any pain with urination?
No.
Any alcohol use?
No.
Any drug use?
No.
Any tobacco use?
No.
Any depression or anxiety?
No.
No. How are you sleeping at night?
You can get anywhere from 6 to 8 hours.
Perfect. Okay. And any spiritual considerations that we need to be aware of?
No.
Perfect. All right. So you've answered all of my questions. I'm going to go ahead and move on to your assessment. Okay.
Okay.
All right. So I'm going to feel your head and your neck. Okay. So I'm just going to go ahead and feel around. I do not feel any abnormalities. Everything looks to be symmetrical. Trachea is midline. Can you go ahead and look to the left for me? I do not see any jugular vein distension. Can you go ahead and look straight for me? I'm just going to feel your carotid artery. Perfect. I'm going to go ahead and move on to the other side. Perfect. I'm not seeing any wounds. Again, there are no central lines. Temperature and skin color look good. So I'm now going to move on to your cranial nerves, which is just some tests, and then we'll move on to some other things, okay? So the first cranial nerve we're going to do is number 1, which is smell. Go ahead and close your eyes. And then I'm going to open this up. Can you tell me what you smell?
Alcohol.
Perfect. Thank you. You can go ahead and open your eyes. Again, that was cranial nerve number 1. We're now going to move on to cranial number 2, 3, 4, and 6, which is your eye. Can you tell me what you see right over here?
4.
Perfect. All right. And then I'm going to shine a bright light in your eye. Okay. All right. Pupils look good. Perfect. I'm now going to move my finger in 6 different locations, and with just your eyes, you're going to follow. Okay. All right. And then keep following, keep following. Perfect. Thank you. All right. We're now going to move on to your cranial nerve number 5 and 7, which is your face. Can you smile for me? Can you frown? Perfect. Can you raise your eyebrows? And then can you scrunch them really hard for me? And then can you puff out your cheeks? Perfect. You can go ahead and stop doing that. Go ahead and close your eyes. I'm going to touch your face in 6 different locations, and you're going to tell me where I'm touching, okay? Perfect. Perfect. You can go ahead and open your eyes. Can you go ahead and we're going to now do your cranial nerves 7, 9, 10, and 12, which is your mouth. Can you go ahead and open wide for me? So I'm just looking in there. I don't see any cracks, no abnormalities. Can you go ahead and stick your tongue out? Go, ah. Can you move your tongue side to side, please? Perfect. You can go ahead and close your mouth. Can you dry swallow? Perfect. All right. We're now going to move on to cranial nerve number 8, which is hearing. Can you close your eyes? Can you point on which side you hear? Perfect. Perfect. All right. You can go ahead and open your eyes. We're going to move on to cranial nerve number 11. Can you go ahead and shrug your shoulders for me? Perfect. Thank you. All right. So we're done with your cranial nerves. I'm now going to move on to your chest. I'm going to look at your chest, inspect. I'm then going to palpate, and then I'm going to listen to your heart and your lungs. We'll go on the forward, and then we'll move to your back, okay?
Yep.
All right. For this video, we're going to leave the patient's shirt on, but in a professional setting, I would inspect everything with the shirt off, and my stethoscope would be touching skin, but we're going to pretend in this video. So just looking at the way he is breathing, depth and rate is normal. Chest is symmetrical. I do not see any wounds. There are no PICC lines. I do not see any IV on his extremities. Temp and color look good. I'm now going to just go and feel around. Palpating here. I don't feel any crepitus. I don't feel any masses, no bumps. Everything appears to be normal. I am now going to listen to your heart and your lungs, but first we're going to start with heart. We're going to start with your aortic. Perfect. And I would listen to all this for a minute. And then I moved on to pulmonary, and then tricuspid, and then mitral. And in any case, if I hear any abnormalities, I would listen to your apical for a minute as well, which does not appear to be the case. I'm now going to go backwards and listen with the bell in each location, working backwards. We did mitral, tricuspid, pulmonary, and aortic. I'm now going to listen to your lungs. Every time that you feel my stethoscope move, I want you to go ahead and take a deep breath in and out for me, and then I'll move on, okay? And just continue doing that. Let's go ahead, deep breath. Perfect. All right. Can you go ahead and sit up for me? All right, I'm going to listen to your lung sounds back here. I'm also, again, I am feeling around. I do not feel any bumps or masses. Assessing, again, this for this video, we're keeping the shirt on, but a real patient, I'd be able to see and feel skin. I do not see any wounds. Skin color and temperature look normal. Their back, and I'm also looking further, buttocks area does look normal, no skin breakdown. So we're going to go ahead and listen, and we're going to make sure that we miss the shoulder blades. Deep breath in. All right, and again. All right, and then for that middle lobe, we're going to be about right in under the armpit and nipple line. All right, thank you. You can go ahead and sit back. All right, next we're going to test your upper extremity strength. Okay, for neuromuscular, can you go ahead and hold your arms out for a minute for me? Perfect. Looking at the skin temperature, I'm not seeing any edema. The temperature and skin color looks good. I'm going to feel for your radial pulse here. You can go and flip over for me. Perfect. Bilaterally, they're strong. I'm also going to do brachial here. Again, bilaterally, they are strong. Can you go ahead and squeeze my hand for me? Perfect. Strength in both hands are good. I'm going to look at the nail beds. Nail beds look good. Capillary refill or under 3 seconds. Sensation, can you feel that? Sensation is normal. Can you go ahead and push against my hands? Perfect. Push against my hands. Again, strength is good. You can go ahead and lower that. No central line has been noticed. I'm now going to move on to your abdomen. Upon inspection, the skin color looks good. Everything appears to be normal. Temperature feels good. I'm going to listen first, and then I will feel lightly, and then I'll push a little harder, okay? All right. You're not feeling any constipation or any diarrhea? No. Any changes in color or odor in your urine? No. And any increase in frequency or urgency? Nope. I noticed there are no Foley bags, which is good. So we're going to go ahead and listen. And I would listen to each quadrant, which is 4, for about a minute. Perfect. All right, so I'm going to go lightly, and then I would press harder after we go around. If you feel any tenderness when I pull away, is rebound tenderness, and just let me know. All right, do you feel that or any pain?
No.
No? Any pain?
No.
All right, we're going to go a little harder. Perfect. Any pain?
No.
At this time, I would also palpate the bladder. We will not be doing that right now, but this is when I would. And I would also clean the perineal area if it was indicated, which it is not. I'm now going to move on to your lower extremities and test their strength. Can you go ahead and lift this foot for me? I would lift them for about a minute. Can you lift this foot for me? Perfect. On assessment, they both appear to be strong. I do not see any abnormalities, no pitting edema. The color and skin temperature appear to be normal. I'm going to look at the nail beds that also appear to be normal. We're going to test capillary refill here. It is under 3 seconds. I'm going to feel for a pedal pulse. Bilaterally, they are strong. I'm also going to go under here. Perfect. They are strong. All right. So we're now going to test your gait and balance. Can you go ahead and swing your legs to the side for me and stand for 1 minute? All right. Can you go ahead and turn this way? Upon inspection, I am looking at bony prominences. I don't see any skin breakdown. Buttocks area appears to be lacking any skin breakdown, appears to be normal. Back looks good. Heels look good. Go ahead and take 3 steps heel to toe for me. Then you can go ahead and turn around. All right, you can go ahead and get back in the bed. All right, and at this time, I would make sure that the bed is lowered and locked. Are you feeling any pain right now? No. Are you currently, do you need to use the restroom? No. I have your belongings and possessions on the table. Do you need anything else before I leave?
No.
Nope. All right, here's your call light. Go ahead and press that anytime that you need anything. But don't get out of the bed. Just go ahead and press your button when you need us. I'm going to perform hand hygiene, and I would document all of my findings of patient tolerance and neuromuscular and everything from head to toe, and I would leave the room.